With me in the studio is a former executive director at the Center for Law Enforcement Education in Nigeria, Dr. Benson Olugbuo. Thank you so much. I hope I got that right.
Yes.
Olugbuo.
Yes,
Thank you.
Thank you.
Great. When you hear the Minister of Health, Ali Pate, say this 28,000 healthcare workers will be absorbed by the Nigerian government, what came to mind? What was your reaction?
I think it's a welcome development because it's a huge number. And for you to throw that number of individuals in the job market that is already precarious also becomes problematic for the country. So I think it's a welcome development, but I just hope it's not a political statement. I hope the government will walk the talk because a lot of people are actually affected by this development, not just health workers. There are also some organizations that receive funding directly from USAID on issues of political development, justice, accountability, and the rest of it that are also impacted by this decision to cut USAID funding. So if government is going to absorb 28,000 health workers into their workforce, that's a welcome development. But I guess before that should be done, I'm thinking government needs to do an audit of all our external funded programs and be sure of how to deal with it. Because nobody can say for certainty which ones will survive within this 3 months moratorium. And then moving forward, whether we will not have other external funders also taking a walk.
Indeed. But when you say you hope this is not a political statement, do you doubt the sincerity of government, or do you doubt the ability to be able to absorb the numbers? What exactly is it?
I think it's both, because the amount of money that the government is calling that they are going to, they've earmarked to spend in the health sector to cushion the effect of the departure of USAID is quite huge. I think it's about $200 million or thereabout. That's a lot of money, taking into consideration our own realities at the moment. The unfortunate thing is that despite the funding that Nigeria got from different donors, the recent statistics actually says that 1 out of 19 women die in childbirth. So there is a high level of infant and maternal mortality in Nigeria, despite the funding that is already existing. Yeah. So the question is, if those funding are no longer there, and Nigeria has to take responsibility of this, are we sure government is going to cover the field, as we say in law? So for me, the worry is, where would they get the money? And
that's a good question, because when you look at the 2025 budget, I mean, this was passed before, we had all of these conversations really boiled down to 28,000 probable health workers losing their jobs. So that funding to cover the 28,000, I don't think anybody has seen it in the budget. It wasn't included in the 2025 budget. So how do you then fund absorbing 28,000 health workers, which some people say actually these are not even professional medical doctors and nurses. These are just community workers and auxiliary ad hoc staff that the USAID aid has been using over the years. But then if the government is not able to fund it, that becomes a challenge. Where does the Nigerian government turn to find funding?
That's a very important question. I hope the government will find funding, but the reality is that there is nothing on the table that shows where government is going to get the money that they said that they have earmarked, about $200 million. The reality also is that government has also been funding some of these programs. I mean, it's not as if USAID was funding 100% of these issues.
That's correct.
I think the critical areas that USAID was actually working on was issues of HIV/AIDS, especially the antiretroviral drugs, and then issue, like you rightly pointed out, tuberculosis, and then cervical cancer, where they were giving vaccination and all those things. And then there are pockets of other activities that USAID was involved in. But the reality for me is that, as I said before, despite what was already on ground, there was a lot of issues in our health sector. We are still losing women, in childbirth. We are still losing children who are under 5. So the worry is that if with the already existing funding that we had with USAID and other donors, we are not able to do a good job, how are we sure that with the shortfall that Nigeria is now saying we are going to augment, how are we sure that we are going to do effective? I think the best thing we really need to do now is to do an audit. Where are the issues that is affecting our health sector? Who is involved in the chain of distribution? How do we import those drugs? How do we do the intervention? And then we ask ourselves, how much do we have? Government is saying that they are making like $200 million to use to augment. But the reality is that what have they done with the previous monies that have been released, even by the government, not to talk of what USAID was using to augment what we're doing. So in my place, they said, if you don't know where the rain started beating, you might not really know where it ends. So the reality is that the health sector is very critical. And, the general saying is that health is wealth.
It doesn't look like we have treated it that way.
It doesn't look like we've treated it that way. And I think the suspension by USAID is a critical moment for Nigeria. Thankfully, HIV/AIDS program was not kind of, they've asked that it can go on,
yes.
Tentatively. But nobody is really sure whether after the 3 months, which programs will continue and which programs will not continue. So the fear is that if government loses these critical components, these, hands and minds and feet that work at the local communities, it will be a problem. One thing you also should understand is that government uses what they call sector-wide approach, in terms of health delivery in Nigeria. There are still some problems with that, because even though we talk about sector health approach, there are still some primary health centers that are not accessible to locals in the communities. So there's quite a lot of challenges that we currently have. And with the departure of USAID, the problems will be compounded. But if the government is saying, this is what we plan to do, I think we need more details than just the pronouncement that has been made by the coordinating minister for health.
Very well said. There's also a saying, and I don't know which ethnic language it is, whenever you wake up is your morning.
Yes.
I guess Nigeria has woken up, perhaps it's a morning. We do believe, we do hope that Nigeria has woken up. Thank you so much, Dr. Benson Olugbuo. That's the much we can have on this conversation. We do appreciate your time on Newsnight.
Thank you very much.